Wow, what a great event so far. I'm so excited to be here. My name is Rebecca Angove. I am the Executive Vice President of Research and Evaluation at Patient Advocate Foundation. I'm also the Executive Director of our Patient Insight Institute. And I'm here to introduce our next speaker, Nicole Caston. She's from the University of Alabama at Birmingham. And she's going to share a project that PAF's Patient Insight Institute actually collaborated on, titled Patient-Reported Discrimination Among Limited-Resourced Cancer Survivors. Nicole is a doctoral student in the Department of Epidemiology at UAB, the School of Public Health, and her work centers around health services research and disparities, specifically as it relates to equitable cancer care for under-resourced patients with cancer. She has extensive experience in large database survey and patient-reported data management and analyses. She's one of our favorite academic collaborators, and I'm so excited to have her here to speak about this project today. Take it away, Nicole.
All right, thank you so much. And hello, everyone. As Rebecca said, I am Nicole Caston, and I'm a health services researcher and a doctoral student at the University of Alabama at Birmingham. And today I will be discussing our study about healthcare-related discrimination among cancer survivors. And we're using the typical definition of cancer survivors, meaning anyone who has had a diagnosis of cancer. And so about 20% of patients with a chronic illness report healthcare discrimination. And in studies involving cancer survivors, they have found negative impacts of discrimination. These include decreased health-related quality of life, fewer cancer screenings, strained patient-provider relationships, and decreased trust in the healthcare system. So we were interested in understanding if and why patients with cancer felt discriminated against in connection with their healthcare. And to answer this question, Patient Advocate Foundation sent out surveys via email in January 2020 and July 2021. These surveys were sent to individuals who had received case management and financial aid from PAF from July 2019 to April 2020. And to capture discrimination, respondents were asked two main questions within the survey. The first question asked if the individuals had ever been treated unfairly or negatively by any of the following in connection with their care. This could include a doctor, nurse, or healthcare provider, insurance company, healthcare system, pharmacist, or none. And additionally, we asked respondents to tell us how or why they felt unfairly or negatively treated. And we estimated the risk or likelihood of discrimination using a statistical model. We included individual demographic variables that we felt needed to be included to remove as much bias as possible from the relationship we were testing. And so these variables included age, sex, race, and ethnicity, annual household income, which was all reported by respondents in the survey. And additionally, we captured rural urban commuting area, which determines or categorizes the neighborhood level as being more rural or more urban. Additionally, we included the area deprivation index, which groups neighborhood levels into either higher disadvantaged or lower disadvantaged areas. And finally, we included patient-reported employment status, their cancer type, and the number of comorbidities or chronic conditions. And so overall, our study included 587 cancer survivors, and 62% of our sample were older than 55 years of age. 72% were female, 33% were either Black, Indigenous, or persons of color, and 25% reported 3 or more chronic conditions. And the most commonly reported cancer was breast cancer, with 32% of the sample reporting a diagnosis of breast cancer. And so when asked if the respondents had ever been treated unfairly or negatively in connection to their care, 23%, so about 1 in 4, reported yes, that they had received some form of discrimination. And of those individuals, when asked who they felt discriminated against them, 58% of those reporting discrimination said that they felt discriminated against by their doctor, nurse, or healthcare provider. 46% said their insurance company discriminated against them. 41% reported the healthcare system, and 14% reported a pharmacist. And so when asked how or why they felt discriminated against, most often individuals reported their disease status as the reason for discrimination. You can see that 42%, that's almost half of those reporting discrimination, felt that they were discriminated against due to their disease status. We took this to mean their primary condition or set of conditions that they were receiving care for. 36% felt discriminated against due to their income or ability to pay. 17% felt discriminated against due to their race and ethnicity. And other reasons for discrimination included age, being older or younger, sex, and insurance status. And less than 10% of the time, patients reported the following reasons here as reasons for discrimination. These included physical traits, their education status, gender identity, religion, language, and sexual orientation. And here you can see the results from our model. And what I want to draw your attention to is what's in the red box. And so those respondents with 3 or more chronic conditions compared to those with cancer only had an 86% increase in the risk of discrimination when accounting for the other variables I mentioned earlier that may have biased this relationship. You can see even for those individuals with 1 or 2 chronic conditions compared to the cancer-only group, there was still an increased risk in discrimination. And so to summarize all that I have presented to you today, the main findings are that about 1 in 4 patients with limited resources as they sought care from PAF reported discrimination most often from their healthcare provider. And that discrimination was most commonly connected to their disease status or income. You know, this is a first look at patient-reported discrimination for our research team, and we're still thinking through how to build upon this and dig into what we found here. But it's very striking that the discrimination is most often from the individual providing them care. For now, we think that structural competency training can be integrated into training for healthcare providers and trainees. Structural competency training, it equips providers and trainees to understand how clinical problems, disease, and attitudes towards certain patient populations or the healthcare system at large has been influenced by upstream social determinants of health, including racism, classism, what Isabel Wilkerson spoke about in her talk, but also policy and infrastructure, environmental, social determinants of health. And so first and foremost, I would like to thank the respondents for completing the survey and sharing their experiences with us, and that we can help together better understand health-related discrimination. Also like to thank co-authors from Patient Advocate Foundation and the University of North Carolina at Chapel Hill. And I thank you all for the opportunity to share our work. I'm going to pass it to Ashley now.
Perfect. Thank you so much, Nicole, for that presentation.